symmetry. I'm splitting her face, I'm giving a invisible line right down. Does this side of the face look the same as this side? Does she have any obvious drooping? Has she had a stroke? Are her pupils the same? You're looking at the pupils. If one pupil's constricted and one is dilated this big, what's going on? That's some kind of neurological, something's happening. Either they had a stroke, they got some neural issues going on, but you're looking for symmetry. So her face looks symmetrical, right? There's no drooping. There's no obvious protrusions of the eyeballs. Her eyeballs are not sunken in. I don't see any of that. If the eyeballs are protruding out, we could be dealing with a thyroid issue, myasthenia gravis, right? So you're looking for all of this with just your visual. Let me make sure I'm hitting everything. Face is symmetric, so that's what you'll say. When you're doing that, you say face is symmetric, no drooping, no weakness, no involuntary movements, meaning she doesn't have any tics. Her eye's not popping out, her eye isn't wandering off, or she's not doing nothing, just normal, right? Then you're gonna come down, you're gonna palpate next. You're gonna look, no periorbital edema. Yes, you have to say that. Say those exact words. If it's there, just say it. No periorbital edema. I'm looking around the orbit. This is the orbital. There's no edema. Her eyes aren't puffed out. There's no puffiness, right? Where am I? No pain noted. So with the palpation, you see that little picture? Those are the sinuses. That's where our sinuses are, right? Can I touch her? You ask can I touch you? Because if we don't ask them, what is that? From Fundamentals 1. Assault, right? Can I touch you? Mm-hmm. Right. So we're going to just gently, with your two thumbs, you're just going to 1, 2, and then right under the eye, 1, 2. Any pain with that? No. So that you just checked their sinuses, right? So no pain upon palpation of the frontal and the maxillary. Frontal and maxillary sinuses. Everybody good so far? Mm-hmm. Any questions so far? No. Okay, you're good. So eyes, now we're moving down to the eyes. Somebody got a pen light? Okay. What real nurses? Okay. Right. Okay. So eyes, the eyes are a little bit, there's a few steps to the eyes, okay? It's not as, so you're gonna have to go a few steps with the eyes. Thank you. I'm like struggling. Okay, so eyes, again, you're inspecting first, right? The eyes are aligned normally, I already said, no protrusion or sunken appearance. The conjunctiva, say that, conjunctiva. Conjunctiva. That's when you pull the eyes down, that's where you put medication. You don't drop, I was just in the ER, not the ER, what is that? Urgent care. I woke up early morning to go work out, and my eye there was something horribly wrong with my eye. I couldn't get it out. I don't know if it was whatever it was. I'm like, I gotta go to the urgent care. I couldn't get around it. Do you know, I went into this urgent care, this was just the other day. This PA dropped an eye drop in my eye, because she numbed it, and then she put the drop in order to see with the blue light. She dropped it, my head was back, I was like, she dropped it from about here. It felt like a bowling ball coming in. That's not how you put medication in an eyeball. You gently pull down, can I? Mm-hmm. So when you put medication in an eye, and when you're looking at the conjunctiva, this is the conjunctiva right here. It's that meaty part. You gently pull it down, drip, drip, that's it. Pull it down over here, drip, drip. So it's not feeling like what are you doing? You're supposed to be a professional PA. I was so angry, but I let it go. I was in pain. I'm like, is there a foreign object? Do I need surgery? Fix me. So, yeah, I don't want to get into that. Okay, so you're looking at the conjunctiva. Is it pink? You know, you're going to pull that eyelid down just gently. Ask them if you can touch it. Eyes are bright and clear. Sclerella is white. Again, you're looking, is the white, is it yellow or is it white? Is it cloudy? What would yellow mean?
Jaundice.
Jaundice. What kind of issues are we thinking with jaundice?
Liver
issues, yeah, GI issues. If it's cloudy and stuff, you know, we're dealing with maybe some macular degeneration and stuff. So sclerella is white and eyes are clear, right? You're looking at the pupil. You're not even using your pen light at this point. You're just looking. Pupils are equal bilaterally. They're about a 3 millimeter bilaterally. When you say bilaterally, you're saying both sides. Equal bilaterally means both sides is equal. And you can see where this little chart down here, 1, 2, 3, 4, 5, 6. So 2 to 3 is normal. 2 to 3 is normal. So you can say 2 to 3. Pupils are equal and round at a 3 millimeter bilaterally. Okay?
Yep.
Okay, flip the page. You guys are doing great. Now you're going to start assessing a little more with this eye, right? A pupil, you guys have heard of Perla? Perla? Who's heard of Perla? Pupils equal, round, and reactive to light accommodation. So the pupils are round, they're equal, they're gonna react to the light that I put in it. So when you put light in the eyeball, when I put direct light to her eye, like this, boom, her pupil constricts. That's normal. Now we're gonna do it to this side. It constricted, and it was even, and it went zoop, just like that. And you'll see it in your patient, in your partner too. So does that happen? Or is it sluggish? What you don't want is it to come in and it not constrict. It stay dilated. Or it's like sluggish. It's not going quickly. That again, we're talking about neurodeficits, okay? So let's look at the top of that page. Advanced pen light in from the side. You always come, so when you're looking at your patient is in half, right? You're coming in from out here, the peripheral. This is called the peripheral. She can still see can you see my pen light? You can see it, right? If I go like that, she can follow this. That's another, we'll get to that. So advance the pen light from the side of the eye. Note the response of the pupil. Normally you will see constriction of the pupil on the same side, right? So the first time you do it, you're coming in, you're looking at that pupil itself. Yes, it is. Now, when I'm talking about consensual light, you see that it says pupils constrict. This is what you're going to say. Pupils constrict to direct and consensual light bilaterally. Consensual means I'm shining it on this eye, but I'm actually looking at that eye. This eye is going to constrict as well. So that's normal. I shine the first time, so direct light. It come in. I'm not going to keep doing that to her eyeball, okay? But let's pretend that this light is on, and I'm going to come in. You're looking at, yes, it definitely constricted. I'll do it. It constricts, and now consensual. Yep, that one definitely did it as well. Now I'm going to do it this one. It constricts to direct, and I'm looking at this eye, and consensual. That's your first test to the eyes, okay? Moving on. Check eyes for accommodation. Eyes accommodate bilaterally. That's on, so ask the client to focus on a distant object. This is the second test you're going to do to the eye, okay? So ask the client to focus on a distant object. So in there, and once you're in there, you're going to look at something on the wall, have them look up at the ceiling tile or whatever, right? Ask the client to focus on that distant object. This will dilate the pupils. So when somebody focuses away, all of a sudden her pupils are going to dilate, right? And then it says here, have them gaze near the object such as your finger or pen light. Eyes accommodate bilaterally. So what you want to do, can you look up there at that vent up there? So I'm watching, I see her pupils are totally open. They're totally dilated. And now I'm going to bring this, just watch my pen light when it comes to you. You're going to take the pen light, you're going to come straight in. So her eyes constrict, her pupils not only constricted, her eyes came right down to her nose. We're going to do it again. Can you look away from there, right? And watch this pen light? That's it. That's all. So that's your next test here. It says eyes accommodate bilaterally. That's all that means. Then we're not going to take anybody to a Snellen chart. It's called a Snellen chart. You guys have done that, the eye, read the number, right? So all you have to verbally say is, I would take my patient over to the Snellen chart to check visual acuity. You don't have to move your patient. You don't have to tell anybody. Just say those words, right? I think that's on. Verbalize that you would now take your patient to the Snellen chart to test for their visual acuity. That's all you have to do for that. You don't actually do anything for it because we're not going to do that. We don't do that. So then we're moving on to the ears. Everybody with me? Yep. Mm-hmm. Yeah. Let's just get these other guys on point and stuff. Oh yeah. Where'd they go? Who came in? Who came in?
We're on the second page.
Uh-huh. Okay, so now we're moving on to the ears. So again, first thing we do, inspection, right? We're looking at this is the meatus. This is the outside. We're looking at the meatus. Let me make sure I'm right. See me? Inspect the ears' position, shape, lesions, or drainage. So the ears, this is what you want to say about the ears. You're inspecting, you're going to look at both. I'm going to look here, and then I'm going to look inside. There's a little bit of cerumen is the word. Cerumen means earwax. It's normal to have a little bit of earwax. That's okay. So I'm checking each meatus. I'm going to look inside. Little bit. So you're going to say just that. Once you do that, you can palpate it a little bit. Looks good. The ears are of equal size bilaterally. So ears are equal bilaterally. No swelling or thickening noted. Right? The external auditory meatus has no swelling, redness, or discharge. A little bit of cerumen is okay. That's all. I'm going to have her cover her ear. Can you just cover your ear? And you're going to say, you have them cover one side and you say a little word. Just say sweetheart.
Sweetheart.
Sweetheart. Can you hold that?
Pancake.
Pancake. Now she knows, right? So you know hearing, and you're going to say that. You can say any words you want. Hearing is intact bilaterally.